Hi, I'm Linda Gromko, and this is Transgender Medicine Made Simple. Today's topic is, what are the expected effects of estrogen or estradiol, and what are the surprises? Okay, so if you are hoping to feminize your body through the use of hormones, estrogen is the medication that you're going to want to be using. Estrogen comes in three forms. There's estradiol, which is the one that we're going to focus on, but there's also estrone and estriol, and those are not the ones that we're going to be dealing with. So estradiol is the dominant hormone in people in their reproductive years. In an assigned female, the bulk of estradiol is produced in the ovaries, but there's some also produced in the adrenal glands as well. So first of all, what is a hormone? Well, this is important. A hormone is a substance that's produced in a gland in the body, for example, in the ovaries, the testicles, the thyroid, pancreas, hypothalamus in the brain, etc. And the substance then travels from the gland that produced it, usually through the bloodstream, to act on another gland or organ in the body. Okay, so it's produced by a gland, travels to the bloodstream, and works on a target organ or gland. So it's best, I think, to think of the hormone as a messenger that signals another part of the body to do its work. Okay, a major function of the sex hormones, that would be estrogen and testosterone and progesterone, would be to promote reproduction. So in an assigned female, another hormone, which is FSH, or follicle stimulating hormone, travels from the pituitary gland deep in the brain to signal the ovary to begin the development of the ovarian follicles to release an egg in the process of ovulation. That's a lot. FSH indirectly signals the production of estradiol by the ovary as well. And estradiol from the ovary signals many effects throughout the body, and we're going to go through those now. Okay, so when a person takes estradiol for feminizing, here are the things that we see. First of all, the first change that we'll see is that the breast bud begins to develop. And it develops under the areola, which is the colored part of the nipple. And it's going to feel like a little bean or a little lentil, something like that. But you can feel that it's a little symmetrical lump, one on each side, on one under each areola. This is the same thing that we see in young girls as they start puberty. So puberty in Tanner stage 2, which is the first stage of puberty, is when you see that breast bud develop under the areola. Then we also see mood changes quite typically. And it's not that people get depressed or irritable or what have you. It's just that they'll tell me that their emotions are closer to the surface. And I hear from people, I cry at puppies, or I cry at Hallmark cards, or this type of thing. So it's closer to the surface. And there may be, interestingly enough, an overall sense of calm. The skin softens, body odor changes. Males and females just smell differently, and you notice this change fairly early on. Here are some other things that happen with estradiol. The body hair thins out. Body fat begins to redistribute, and this makes a person look more typically feminine, okay? But this is a highly variable process, and it can take years to occur. And I often hear people who are looking for these early changes, and I always feel sad that those changes don't happen faster for them. The libido, or sex drive, can decrease. People will have fewer morning or random erections. And this oftentimes is a very good thing for people who are transitioning female. People still can have erections when they want them, and there's help in the form of drugs like sildenafil, which is Viagra, for example, or tadalafil, which is Cialis, which can be helpful for people who are wanting help in that area. But there are some surprises with estrogen too, and I think these are important to warn people about. One of the things that comes as a surprise is that the ejaculate decreases in volume, and it becomes clear or even absent. People can still experience climax, but they just won't ejaculate fluid from the penis. There's a decrease in testicular, prostate, and penis size, which I think is a courtesy to let people know about that. Thirdly, we will see a decrease in physical strength, and this is important for people who have very physical work, for example, that they may know that they may not feel as strong as they have been in the past. Unlike unlike testosterone taken in trans males, estrogen does not have an effect on the voice pitch. So when a person is feminizing and trying to make their voice sound more female, that change usually comes from coaching or perhaps practice, for example. There's even surgery that can help people in that, but it's not an automatic thing as it is with the taking of testosterone and the voice dropping down very early. Estrogen has generally no effect on hair thinning or balding. So if you are programmed to be balding as you get older, estrogen is not going to save you, but there are medical and surgical interventions that can help. So, don't despair. There are some things that can be done if that's a problem for you. And finally, what about progesterone? Progesterone is another hormone that's put out by the ovaries. This hormone can encourage breast development in some people. I don't think it works in everybody, but I certainly see that there's a subgroup of individuals who will find that breast development does kind of take off under the influence of progesterone. It does not seem to affect people with the PMS irritability. We can see some mood or sleep changes in some people. But when I started prescribing progesterone for transgender women, I was concerned that people would have PMS irritability. Progesterone is the dominant female hormone in a person's menstrual cycle. That's the hormone that we see most dominantly right before a period. And so that's the hormone that you kind of equate with crankiness or irritability. And so I was worried that in prescribing this for trans women that we would see the trans population of Seattle get PMS, but they didn't. And what happened is that occasionally you'll see somebody who has some mood effects from it, but in general, people just feel better when they're on the proper hormones. So that's the information I have for today. I hope this information was helpful for you. If this was, please like this video and subscribe to my channel if you haven't done so already. Thank you for watching, and I'll see you in the next video.